The following segment is sponsored by Intermountain Healthcare and the Utah Department of Health.
Most kids have been infected with a respiratory virus by the age of 2.
Yeah, Christina Flores has more in tonight's Baby Your Baby report.
Late winter, early spring, we see a lot of respiratory viruses.
Anyone at any age can become infected with a respiratory virus. For adults, this looks like your common cold, but with children, symptoms can be much more concerning.
So you get infection of your nose, your throat, you have a sore throat. It can even cause a little fever. And the biggest concern is when it becomes a lower respiratory tract illness. We call that bronchiolitis. It mostly affects kids less than 2 years old.
Dr. Stephen Aird with Intermountain Layton Parkway Clinic says symptoms of lower respiratory tract illness include chest retractions as well as labored or rapid breathing.
You know, a child less than 2 typically will be breathing less than 60 times a minute.
If a child is breathing more than that, it's a good idea to have them looked at by their provider.
My main job is to determine, is this somebody that's safe at home or is this somebody that needs to have extra support like some oxygen or other things to help with that?
If your child is sick, there are a few ways you can help manage their symptoms.
You can do things at home to help clear out the upper airway using nasal saline and maybe some suction devices to help keep the airway clear.
If your child is getting worse, especially if they are struggling to breathe, it's important to get them to a safe environment like a hospital as quickly as possible.
It's probably better to overestimate your concern rather than underestimate your concern because things can change so rapidly.
Christina Flores, 2 News.